Hospital. Angau am stop inside long, Lake City, where me housing international community planted population of Papua New Guinea staff long and look out him. We last him minister where you are aware was yes, almost 2 weeks ago. One blood time an incident where blackout may come up, na 7 Plamanda. Minister, you are aware of this law or not? Suppose this law me resort power blackout, me like minister blong power too must clear this law. And ask him too must go long and too long and must clear him why reason why suppose no got adequate power supply go long slack. How she go on around him scan on around him all city scans or one him all power me require him long and run him all machines. That's not come up. Is it for the reason that power me suppose blackout not is like come up? Okay, then suppose you got standby generator, why in the same time generator off? Mr. Minister, suppose there's a problem inside Lons, la PHA, Blom Morobe, in a bayou talking people Blom Morobe and people Blom Papua New Guinea. Why? One a mass, not that generator wasn't working on that day, the very day. Suppose Osla die and come up because of Nogat Marasin. Minister, you find out now you're talking me blah. Why not? Suddenly, 7 people dead on the same day. Not two. I think Cube law this last scheme, me too, Kolong, or Arab member last scheme law. Or PHA, suppose let me not manage him. Or medical supplies or Marasin Blomibla Kolon rule areas. We plan the man to die along. Or districts Blomibla in Salong Morobe, where no God man name is away the number. Minister, suppose let me come up with attention, blue or no God. You working one and something, long address him this la heavy. Thank you, Mr. Speaker.
The Honourable Minister for
Los kisim putim order blow golo supply credit store na kisa supply blow golo have. Him looks level sem they were igata the area medical store blow enga do lay even burn last year. Fire cook him last year. Na government allocate him on 20 million kina this year lo rebuild him this la nubla area medical store. Today them released finish 15 million kina release go finish. Tender pro is now on, and I appeal to the NPC team. It's very slow. Can they fast track the NPC requirement and process so that this project or area medical store must fast track na complete money go finish. Na project go all na the Department of Health keep money stop now waiting my process to go through. All this relating along having a good storage facility in place na kisa marsin come in time na make also. Some of the information I'm just sharing with today. Come point law power supply as outage law Angau Hospital. Next report the CEO lo happen to law. They want a big concern. On the 18th of October, lo up 9 p.m. lo afternoon, 9 p.m. lo night. Na power come back lo 5 p.m. lo Sunday lo afternoon. I'm close to also 20 hours power blackout lousy. A big lousy you got power blackout. Even 3 minutes of power blackout lousy can big a problem. Even 1 minute. And 1 minute too long, housing power blackout is a serious problem. Now this line 20 hours, 9 p.m.
Honourable Minister, we have a point of order.
We are Minister Salat na totok na. Narpla Minister responsible for power signal lahap na. We have a serious issue in lay, but there's no problem totok long and we wait to one kind. Oga the province marang to one kind. And the government is complaining. The minister should be telling us what the solutions are.
That's right, not complaining.
Not complaining. No, it's not an answer. The people want answers. He's not answering, Mr. Speaker. He's complaining.
Correct, he's complaining.
Honourable Governor for speaking. I think the minister is now on the question to answer, so I'll allow the minister to continue. Honourable Minister.
I'm just stating the fact what has happened. I'm just stating the fact what has actually happened because member Bloim asked him, you got power blackout lo have now. You got the line here die. Also nila talk sabi clear say yes, you got power blackout. Na report come also 20 hours straight power blackout now. One standby generator blow suppose lo kick in area even have been walked to. So we have actually established all these facts now that economic management now we got board staff long. Make sure that all these things are happening. I'm just presenting the report that actually happened on this particular date, on the 18th to 19th. Actually, we do not agree. We condemn these particular arrangements, and each of the PHAs, they are responsible. They are responsible. They've given money. They're supposed to make sure that there is a standby every time system in place.
Two-plus generator bagarap because blackout for 3 days. Standby generators for any of you that have been to school are not supposed to run for 24 hours. Or supposed to cut in, now only work 8 hours, now only go off. We are going to...
Honorable Governor.
No, me like him, me like him, octave power, I come now.
Honorable
power.
Governor.
I'm sick of PLG power.
Honorable Governor, I resume your seat. Your point of order, out of order. The Honorable Minister, you continue on your... I cannot allow for you to debate on the question that is being answered. This is question time. So allow the Minister to...
Thank you very much, Deputy Speaker. Yeah. Yes, the result, the reason for the blackout, I'm affecting generator blow outsick. Generator blow outsick now, generator in open, I'll talk about some issue long and I'll try my best to straighten him. That actually, that number of hours resulted in, yes, we can talk clear. Remember I talk law of 7 blood die, but they get report the camera CEO up to close 5 blood die. They got 5 blood die come up. 1 blood die, die time only work long, only wait long, emergency department. Somebody was rushed to emergency department during the time when there was a blackout, so unfortunately they lose a lifeline. Now you got 4 blood where they were expected deaths. I mean, some prognosis long and poor, and they were actually waiting to die. I'm also sorry, you got some line where prognosis poor.
We have a point of order.
Can the good health minister withdraw that statement? You don't pass prognosis on patients and you don't sort of pass a verdict on their life. It's totally wrong. You are not God to pass their judgment. So can you withdraw the statement, please?
Honorable Member, your point of order is in order. Honorable Minister, you can stress on your reply. Thank you.
Thank you, Mr. Speaker. Just want to say that there were 5 deaths, and during that other particular period where power blackout, you got 5 that die come up now. In people sorry, you slightly come up. That's what we're doing now is yes, I'm an unfortunate situation of power blackout law in Angau Hospital. Angau Hospital can be big lausik inside the city. Now, I support him to start the Morobe PHA. Now, start also got 10 districts inside the Morobe. 10 districts. Population blow laboratory close to 1 million. That's a lot. And many of the deliveries will come along Angau that's all. One can also mention here. Okatol Mamala Karem Okatol PMJ na stuff. So if you look him, Angau is actually stressed out in trying their best to look after many of the cancer patients are now going to Angau. At the moment because of reopening of cancer facility, we have 800 line go now along cancer facility in Angau as I speak today after reopening. That's actually saving themselves a lot of money. So apart from looking at the cancer patients, they are also forced to look after every others. A report comes also only got to 100, close to 200,000 line only column emergency department outpatient last year. That's a lot. That's a lot. So come back now long small PHA team long have organized small system long na. Steady the more PHA look law how they gonna reorganize the health delivery primary health care long Angau within the lay city. The way forward is make call upon our landlord, the business sectors lay please I appeal to them today. They have a business rep on the PHA board to come in where they are because then by taking 3 or 4 weeks look simum the part stand by generate the blow along Angau Hospital. That's coming overseas. They will need to fix that by taking 3 or 4 weeks. So when they are doing this, I'm always spending close to some 5,000 liters of fuel every 24 hours. And that's a lot of money. Now me appealing along online law lay suppose all our business houses they can come forward and support Angau during this period of this time of stress to come in. Only is the money blow, but suppose you got some way where business line can come in or anyone come in and me like appeal to the Minister for Health. Angau need him assistance. Angau Hospital at the moment, they need our support. They need our support. We need to come in and support where we can. They're trying their best, government give money, but that's where we are. That's the situation in Angau. It will need about 3 more weeks.
Honourable Minister, we have a point of order.
Thank you, Mr. Speaker. The good Minister has just been providing a rambling response to very, very simple and serious questions raised by both the Governor and the member for Kabwum. Can he just confirm how much money he's received from the budget, and why is he saying that they're trying their best, your best is simply not good enough? How much money has he received to say that they still need all the help they can get from business sector? Thank you, Mr. Speaker.
Honourable Member, I've listened to your point of order, but point of order is like you asking a new question in a point of order. So I think the Minister have taken note of what you said. I'll allow him to finish up his reply. Minister.
Thank you, Deputy Speaker. The CEO is actually doing a recruitment of up to 500 more staff into the Honourable PHA as I speak. And the government committed 233 million this year. We will see an increase of 7,000 workforce in the PHA system. Honourable PHA is recruiting another 500 to actually support them as well. But again, the way forward, which I've recommended in the department, is there will be we want to see a system where Morobe begat PHA belong separate lo Angau housing. A minimal sem Port Moresby Hospital operating by itself, and they have their own board, they have their own management team, because some big set up to us. By arrangement where Morobe PHA operate outside of Angau Hospital. These are some of our points that we're considering at the moment, so that there's additional resources for health coming to Morobe province. And some of the things we got long at the moment. But when I talk thank you on Kabwum Australia, we know that the government of Australia committed so much funds to upgrading the current Angau Hospital. But again, coming to the point, we will, Department of Health, fully supporting Angau the situation is at the moment. We are giving them support, and we'll continue to stand by them to make sure that we resolve this power issue as soon as possible. Thank you, Mr. Speaker.